We're going to get our kids back to school in a way that looks and feels as much as it used to. 5 days a week, 5 hours of instruction a day.
We're being cautious. We're taking extra health and safety measures. We are putting in the necessary dollars, and we are supporting parents through this process. Because as the Premier, the Deputy Premier and I have said all along, we will do whatever it takes to keep your child and our staff safe in this province.
We have 33 days until staff are expected to be in school. I think the timelines are very tight to do all of the things that are required.
Everybody said a lot of nice words, but I don't have a lot of details that really satisfy me. I'm really uncomfortable with the idea of my kid going into a classroom with 28 other kids.
The pandemic has put school on hold. It's turned life upside down for millions of students, parents, and teachers. But Ontario's classrooms will be open for learning this September. I'm Chris Hensing. Thanks for joining us. We start with breaking news tonight. It has to do with the future site of the new mega hospital. The Ontario Divisional Court has dismissed a motion for leave to appeal from a recent decision of the Ontario Local Planning Appeal Tribunal brought by CAMP. That's the Citizens for an Accountable Mega Hospital Planning Group. Now, they lost their appeal in December through the tribunal and filed a case in the Divisional Court system. The court has awarded costs to the City of Windsor and Windsor Regional Hospital of $25,000. This is a breaking news story. News just coming in to our newsroom. Mayor Drew Dilkens held a press conference just before going to air. Here's what he said.
We still need important stage 2 approvals and funding from the Ontario Ministry of Health to be able to proceed with the detailed design stage of this project. And then this hospital project will require a major capital contribution from Queen's Park to be able to get and to go to tender to get built. So I want to be clear, this ruling doesn't mean that we get the shovels in the ground next week or even next year, but hopefully it marks an end to the needless delays that have set our region back.
Now, we've also received reaction from CAMP themselves through their lawyer, Eric Gillespie. It says, in part, CAMP was successful on a number of the issues it raised in its leave motion. For example, the court found the majority of CAMP's issues, 3 of the 4, raised proper questions of law, part of the test for granting leave. However, the court determined for a variety of reasons that the issues did not satisfy the balance of the test for leave, adding, quote, as is done in the normal course of any case such as this, we will be advising our client regarding its appeal options. A decision regarding any appeal will be announced once it has been reached, which will be shortly. Very much a developing story that we're following closely. You can find more on our website, cbc.ca/Windsor, as we continue to watch this story. And we'll have both Mayor Drew Dilkens and the lawyer for CAMP live on Windsor Morning with Tony Doucette tomorrow just after 7:30 in the morning. Continuing with news today that the Ontario government has announced its back-to-school plans. For elementary students, class sizes will remain the same. Students are going every day. In high school, classes will be kept to a maximum of 15 students, with students only going back to school half of the time. Lorenda Redikoff takes us through the plans and the reaction.
You can drop your child off at school, knowing that every possible measure is being taken to keep our children safe.
Elementary students will be headed back to regular classes every day for 5 hours. Lunch will be eaten inside the classroom, not the cafeteria, or at staggered times.
We need to look at the children's health, and it is not healthy for them to keep staying at home. They need to go to school. They need to go to school for their development, for their health, their physical, social, and mental well-being.
Masks will be encouraged for younger kids up to grade 3, mandatory for grades 4 and up, with exceptions granted. PPE provided for teachers.
The advice I have received from public health is that the risk is greater amongst those older children in high school.
In high schools, in larger school boards, students will spend half the time in class, the other half working remotely, kept in cohorts of 15. In smaller and northern school boards, it'll be full-time. The government is committing to spend an extra $309 million. The biggest chunk, $80 million for extra staffing, including 500 public health nurses, plus extra cleaning. The opposition argues it's not enough.
It is clear that the Ford government has put together the lowest cost bargain basement scheme that they could come up with. And it is going to put both our kids' health and their academic success at risk.
Unions are frustrated too and say they weren't consulted.
Extremely problematic. Grocery stores, bars, and gyms in this province have more safety protocols in place than our classrooms will come September.
This single mom of 2 young children is on one hand relieved.
Tears came to my eyes that we are doing a full-time opening and that we are investing money into it.
But she's not convinced. It follows a report that came out yesterday on how to return safely.
My kid is going to be in a full-size kindergarten class, and that my mom is 77 years old. She's in our bubble. We see her regularly, almost daily. She is immunocompromised. I am a little nervous. I would prefer that they cut those classes in half.
Families who aren't comfortable going back to school can opt out, with children learning online. Teachers who don't want to return would be expected to teach online classes. Lorenda Redekop, CBC News, Toronto.
Now, here in Windsor, Essex, both the English public and Catholic school boards are considered designated school boards. So you heard Lorenda talk about some of the differences there. Secondary students will be attending in alternating days in cohorts of about 15. Elementary students, they're going to return 5 days a week. It's a frightening thought for some parents. Jacob Barker, live with us here tonight. You've been hearing from parents, students as well, about how they're feeling. What do they think of this announcement?
Yeah, well, Chris, there were lots of concerns, and while it was a pretty detailed plan that the government gave today, parents want to know more. They're asking for more details about just how it will look when their kids go back to school come September.
What happens when you have a positive test or a symptomatic person?
Therese and Walker Hounsel headed into today's announcement with a lot of questions.
As we've always said.
Listening closely, they hope to hear a plan to get Walker back into school. After the announcement, the questions were still there.
Symptomatic. So he has allergies, say. One day he has a runny nose. Does that mean he goes home? If both of us are working, where does he go? Right. Who looks after him? What if there's an outbreak? What if there's a teacher that's afraid to go back into the classroom? What if, all the what ifs.
What they do know is that there is a plan to go back. For Walker, heading into 5th grade, that means 5 days a week, including recess and lunch, and wearing a mask. He's excited to be heading back.
I'm counting down the days. I can't wait to go back to school. I'm very excited.
That's right.
I never thought I'd hear a kid say that.
I know, I never
COVID
thought
man does crazy things, right?
But for Mom, there's still some convincing to do.
I want him to have what he wants, but I also don't want to put him in a situation where I don't know he's going to be as safe as possible.
My first reaction from the plan is that it's just too soon.
Meanwhile, Melissa Lewis says it's a daunting thought to send her daughter back into the classroom. She thinks teachers will need more time to figure it all out.
I think this plan is rushed. I don't think it's about the kids. I think it's about the economy for a lot of the officials. And I worry about sending my 4th grader back to school in this.
Aaliyah misses her friends, misses her classes, especially gym and art class. She says she's kind of nervous about going back.
It could be safe, but some people could also have coronavirus without them knowing or them feeling it, and then passing it on to someone else, and then end up everyone having it.
Well, now that the province has given its vision for getting kids back to school, it's up to the individual school boards to give their plan to get kids back into classes. I'm sure parents will be listening to what they have to say very closely. Chris?
Certainly, Jacob. The CBC's Jacob Barker live tonight. The education director for the Greater Essex County District School Board is glad to hear some details of the reopening plan that came out today.
We know that masking for students grades 4 to 12, it's very helpful direction. We were also given some, I believe, some funding. I don't know the details of that funding, what it works out to affect our board, but with attention to custodial staff, public health nurses supporting schools. So some of those things are good.
Now, the president of the Ontario Secondary School Teachers Federation has concerns. She also represents elementary teachers and is concerned about safety, saying that 33 days is not enough time to prepare.
It seems like they're opening 5 days a week fully. Windsor Essex obviously is a hot spot. And so for the members that we represent in elementary, I think that it's a serious concern, because where can we go in this county where you're in a room for 6 hours a day with 30 kids, or 30 people in general. And so I think it's a grand experiment to see how that works out, especially in our community where we've had the levels of COVID that we have.
Now, the Catholic Board also reacting today. Their communications director saying that they're pleased the ministry has provided more guidance on the opening of schools. The statement reads in part, "Based on today's announcement, we will continue to refine our plan before posting it to our website for feedback from the community. We will meet with our trustees on Tuesday, August 4th, so that they will have an opportunity to review that plan." Windsor Regional Hospital is at capacity. They're seeing more patients suspected to have COVID-19, and they're considering firing up the field hospital because the curve is rising, and the people using ventilators, they're seeing a shift in the demographics. They're younger than they were at the start of the pandemic, some patients in their 30s. Now, I asked the hospital's chief of staff for his thoughts on how the public is handling this pandemic and what he's noticing now among his staff.
With the curve, you expect it to go up and then come back down as you get control of it. And then you open up and then it comes down so you don't overwhelm the healthcare resources. Unfortunately, we opened up and it's not coming down and it's continuing to rise, and that's a problem.
Is this a case where we may need to go back to some of the restrictions we had before to buy staff at the hospital more time to prepare for these new cases?
Well, if there is a silver lining here, our ICU is not at capacity. Not that we want it to be at capacity. The overall hospital is at or above capacity, not just from COVID patients, but also general medical patients. We have patients who delayed in getting treatment for heart conditions and stroke who are occupying our cardiac care unit beds. And when we opened up surgical, when we were reintroducing surgical services, patients requiring surgery are also using some of those beds. So those are the three main reasons why the total hospital capacity is high. I don't think we need to roll back anything right now. But again, if we don't get control of this and the numbers continue to rise, that may become a possibility. And the other important thing to note is the demographic that we're seeing has shifted. In the early days of the pandemic, it was mostly 60, 70, 80-year-olds that were on our ventilators. Now we're seeing a clear shift into the 30, 40, 50-year-old range. We do know that children are susceptible to the virus, even though maybe not as much as adults, but they still acquire the virus. They can develop quite significant medical conditions from it. So it doesn't discriminate. And the other thing that people need to realize is, based on the numbers and the spread in the community, if you start having gatherings that are more than what's recommended, you can almost bet that that COVID is attending your party. If you're having a barbecue and you have 100 people there, COVID is at your party.
How are people feeling who are looking after the sick, who have been what many have said either the front line or the last resort during this pandemic, as they watch that caseload start to go up again?
When we first started, there was a lot of anxiety just before we had our first case because you didn't know what to expect. Then we had our first case. People started to become a little bit more relaxed, and I'm talking about doctors and nurses and all the frontline staff that are looking after these patients. And then we flattened the curve, and then we had no inpatients. So there was a bit of a lull, and we were very clear with everyone. Take as much vacation as you can or as you need. Take a break, because we were all expecting a second wave sometime in November. And I remember joking with you when we were doing a tour of the field hospital that I had a nap scheduled for July because I was expecting things to be a little bit more quiet. But unfortunately, that didn't happen. So it is putting a bit more strain on everyone that's looking after patients because, again, this was supposed to be our break, a lull in preparation for another wave. It's not happening, but again, we have a tremendous group of professionals here that have that help each other out. We have lots of resources for people who feel overly stressed and need a break. And I think it's such a collaborative and professional team environment here that I have no concerns that we're not going to be able to continue to look after patients as sick as they are.
Now, Dr. Saad said that his next nap is scheduled in January. Clearly, everybody working hard here. Both health units in Chatham-Kent and Windsor-Essex are trying to contain an outbreak of COVID-19 in the Low German-speaking community. Now, this community was the one that Premier Doug Ford brought up last week. It includes Mennonites, but there's also Low Germans in other religious groups, and there's those who aren't religious at all. The health units say that there's been a surge of cases. They're not saying how many or how severe, but both say it's affecting people across multiple regions in southwestern Ontario. Now, this morning, CBC's Katie Fraser asked Dr. Wajid Ahmed about their approach with the community. Here's what he said.
And when it comes to these outbreaks in low German-speaking communities, what are some of the challenges you and your team are seeing when it comes to relaying those messages of public health and making sure that they're staying safe?
I guess the biggest part is the collaboration and the understanding that we are there to support them, and we're not trying to make things difficult for anyone, but instead we are trying to protect them and also their families and their loved ones. As much as we want to be supportive, we recognize that sometimes it can be seen as being too intrusive and getting into the very specific details of everything that everyone is doing. So we want to make sure that at least that part is there. And the most importantly is the concept of community in general. We want to make sure that they recognize that we are there to support them. They are part of our region, and they should have all the tools and supports that is available to everyone else in the region.
Prime Minister Justin Trudeau appeared before the House of Commons Finance Committee today. He testified about the government's aborted deal with We Charity to manage a student grant program, one worth more than $900 million. Now, critics have accused Trudeau of giving preferential treatment to the organization because of its close ties to his family, but the Prime Minister denies any wrongdoing.
I did not influence the public service to choose this organization. And indeed, when the public service came forward with this organization, I said, you know what? Let's put the brakes on it. Let's make sure that it's done absolutely everything right, because there are going to be questions because of the connections with my family on this.
Trudeau is also facing an ethics investigation. It's his third since becoming Prime Minister. A live look outside of the Ambassador Bridge there. The clouds looking beautiful as always. A couple boats going under below. No watches or warnings to tell you about right now. Rare considering the summer we've had, but a long weekend right around the corner, and we will get into all the details of what we should expect next. Joining us now for a live look at the weather is Nick Cirkovich. I've got a keen eye on the forecast for this weekend. Supposed to go camping out in Chatham, Kent. But
Is
if
that
that
right?
Sunday, Monday action looks like as it has this week, I might might ditch the tent.
Well, you know how it's a long weekend, right?
Yeah, we got one of
Because
those
it's supposed to
coming
rain.
up.
Yeah. That's how you know it's a long weekend.
Absolutely.
And then when you're going camping, it's like leaving the sunroof open on your car. It's going to rain.
Yeah.
Anyway, I'll get to the forecast in a sec. I have a little glimmer of hope for you, but there is some rain in the forecast. That is part of our headlines, Chris. We've got mild temperatures, sunny start to August into Saturday, but again, weekend rainfall. I'm going to come to that in the long range here in a sec. 26 degrees right now in Windsor with the humidex, feels like 31. Not too bad, actually. Pretty good summer day. A little bit of high cloud cover, but for the most part, we're just looking at sunshine across the board there. As we head through tonight, look for clear skies tomorrow. A little bit of on and off cloud cover, but for the most part, we've got sunny skies tomorrow. Same story heading into Saturday, but this is what I'm talking about for Sunday. Now, in terms of rainfall accumulations, this is what one forecast model is saying. It could be anywhere from 40 millimeters of rain, so I hope Chris has a good waterproof tent. But here's the thing. The forecast models are very undecided on the track of this system. I'm looking at a few, and they're different. So I wouldn't put too much stock in these numbers exactly. This is the range that we're looking at, potentially 20 to 40 millimeters of rain. But where we see it could vary. One of the models pushing it further to the south, one of them, the one I'm showing you, pushing it further to the north. So we're going to have to keep an eye on that as we go through tomorrow and into the weekend. But a heads up for you anyway if you do have outdoor plans. 17 degrees through the overnight. As we move into tomorrow, highs to 28 degrees again, pretty much bang on seasonal temperatures. Mainly sunny skies. A little bit of cloud cover, but for the most part, we're looking at sunny skies. 28 carries through till Saturday as well. There's your rain. For Sunday and Monday. I should have put a little picture of a tent there. And then as we get into Tuesday, 23 degrees. So my glimmer of hope here is for you is that the track is still undecided, okay? I mean, it can shift a little bit. It's going to rain. Just depends whether you're up to your knees in rain or up to here. Yeah.
It's very funny because I'm also undecided, and it all depends on that track. There's very much a yin and yang thing going on here.
There you
love
go.
this. All right, well, we'll figure out how it goes. I'll send some pictures to you to let you know how bad it actually gets out there.
Well, I hope it's not that bad.
That'll be okay. Thanks for this, Nick.
Cheers.
Now, in Windsor, Essex, because of the pandemic, there's just one public pool that you can take a dip in, and it comes with some rules. We'll have some more on that coming up. Cyclists in Windsor have a new trail that they can use.
I'm thrilled about it. Basically, it's the kind of infrastructure that we've been looking for, in that it is connected to existing trails, it's off the road and protected, and it runs through an area that is a workplace. I mean, we've got thousands of people working along Rhodes Drive who now can have a safe way to get to work.
Now, it connects Walker Road and Rhodes Drive, the first of two phases of a trail that will eventually continue east from Rhodes Drive to Jefferson at Quality Way. The 2.6-kilometer trail runs just south of the EC Row Expressway, and the section opened today was built at a cost of $976,000. About 2/3 of that money came from the province. The project is part of the Walk Wheel Windsor portion of the city's active transportation master plan. We are in the thick of summer. If you're looking into cooling off by taking a dip in a pool, there's one pool currently open in all of Windsor, Essex. That's a public pool. It's the town of Essex that has opened the indoor pool earlier this month, and they're offering swimming classes with a few modifications.
Well, I've only been in one class so far, and it's been with my friend that's in my bubble and my cousin who is also in my bubble. So it's not much difference because we already are not like playing together usually, but like it's different because like the teacher can't come in the water with you and all that stuff and like help you with all of it.
Big differences are ratios. We were teaching anywhere from 1-on-1 up to 10-on-1. Right now we have a maximum of 3 participants per instructor. As I said, instructors are teaching from out of the water right now and reviewing the guidelines between stage 2 and stage 3, whether or not that instructor can return to the water with a physical distancing in place. Mostly it is a much smaller class, it's a different pace, and the involvement of parents in our Learn to Swim program is new, but we found that it's really enjoyable, and parents who are doing it are actually finding it different but fun for them as well to interact as an entire family. It really has been wonderful to reopen again. We've missed the people that were here. They've missed us. We have had overwhelming support of our returning participants, and we're happy to see that continue and go forward.
It seems very safe. They come dressed in their swimsuits. They wear their masks in. They do their lengths. They put their masks on and they walk back to the car. So right now I'm not overly concerned. Maybe in winter months when there's more interaction with the facility, I might be more concerned, but I'm hoping by then we'll be past the worst of it.
I think we all are. That is it for us here at CBC Windsor News. To recap the top story today, the Ontario Divisional Court has dismissed a motion for leave to appeal from a recent decision of the Ontario Local Planning Appeal Tribunal brought by CAMP. That's the Citizens for an Accountable Mega Hospital Planning Project. Now, this has to do with the site of the new mega hospital. We have more details on our website, cbc.ca/Windsor. And tomorrow morning, we'll have both a mayor and a lawyer for CAMP on Windsor Morning with Tony Doucette just after 7:30. That's it for us tonight, though. Thanks for watching. You will join Power and Politics up next. That is already in progress. Make sure that you and your family have yourself a wonderful evening.